Life in sub-Saharan nations, such as my country Ethiopia, makes development challenges undeniably real. It also affords you the opportunity to reflect internally and aspire to bring about change. Appreciating my environment's burden of disease, my life's ambition starting at a young age has focused on mastering the art of medicine. In order to curb a high maternal and child mortality rate, I initially focused on an obstetrics and gynae practice in a large urban public hospital. It didn't take long before I realized how a fragile health system can be frustrating to both clinicians and patients. I witnessed many unplanned pregnancies as a result of lack of awareness or access to family planning. I saw mothers abandoning their newborn because they cannot afford to provide for them. Clinicians, including myself, were desperately frustrated, despite our best intentions to help, as a result of lack of basic consumables, medical equipment, and poor management practices. It was evident that, unless the health system was revolutionized, my craving to achieve maximum impact at scale would remain an unreachable goal. To realign my career and dedicate my efforts to public health, I joined the Ministry of Health and became part of the needed health system transformation. I was absolutely clueless when I joined the ministry what it took to address our health system challenges. Clearly, it was much easier to be on the blame side. I was unaware of the severe resource constraints, combined with the gap in capacity and the lack of awareness by the community, and the resulting painful trade-offs that one has to make as a health system leader. Change at national level was very protracted in this challenging environment. On the other side, serving at the Ministry of Health for 8 years in different technical and leadership roles allowed me the opportunity to be part of Ethiopia's success in putting in place a community flagship initiative, the Health Extension Program, credited for the country in achieving most of the Millennium Development Goals. I am currently a keen believer that there is hope, and with dedication and good leadership, we can get to our vision of attaining universal health coverage. As Mahatma Gandhi said, if you want to change the world, start with yourself. Indeed, I have started with myself in believing in being part of the solution rather than the problem. We live in a world where resources are limited, and even more so in low-income countries like Ethiopia, forcing us to make painful trade-offs. My vision is to take my country's priority-setting practice to best-in-class and promote good policy making to address health inequalities. I aspire to contribute to evidence generation and to putting in place robust participatory and transparent priority-setting practices. I aspire to become a voice for the voiceless for neglected problems such as non-communicable diseases. My vision is to see a country where everyone enjoys good health, where its community and leaders are empowered to set their own health priorities and maximally contribute with their full potential. An environment where decisions are made based on evidence, where its leaders are true implementers, transformers, and servants, and where women are equally represented in public health leadership rather than being exceptions. My vision is to be an empathic and a servant public health leader and positively impact the lives of as many of my people as possible. I look to remain vigilant, continuously challenge myself, grow professionally, and become a voice and a movement in health system excellence. I believe I'll be able to meet the need at the individual level while aiming to create a catalytic technical and behavior change in colleagues and systems. I believe we must be the change we wish to see in the world.